Thank you, Speaker. My question is to the Premier. OPSU, SEPFO, Local 5115 workers, the frontline workers of the Regent Park Community Health Centre, are on strike for fair wages. This government is starving public health care. Their wages were frozen by Bill 124 during an affordability crisis, Speaker. These healthcare professionals are doing some of the most difficult work in this province, literally at the epicenter of a poison drug supply and opiate overdose crisis. Despite all of this, they continue to show up for our communities doing that hard work. Will this government show up for them in today's budget and fund public health care so that they can get back to work and receive the fair wage that they deserve?
The Minister of Health.
Thank you, Speaker. While I'm obviously not going to talk about a specific labour relations that is happening, I will say that public health units have had a 16% increase since 2018 when we formed government, and that is, of course, outside of all of the investments that we made sure were in place for our public health units to protect the people of Ontario during the pandemic, and obviously making sure distributing the vaccines to people to keep them safe. I will say, a 16% increase for public health units across Ontario is unprecedented. Of course, in the last Association of Municipalities, we also made a commitment and shared with our municipal partners that a 1% increase was part of our plan to invest in public health in the province of Ontario. Thank you, Speaker.
Supplementary, back to the member for Toronto Centre.
Yes, thank you very much, Speaker. And back to the Premier. Political messaging will only get you so far. That spin is not being believed by anyone. The people who agree with you, the only people that agree with you, are private healthcare investors who are looking to gut our public healthcare system. Real, honest Ontarians like Kirsty Millwood, who actually is in the chambers today to listen to this debate, is a frontline foot health worker and the president of OPSU, SEPFO Local 5115. And she tells me, we need funding for community health care centres. We need to provide critical services. We keep people out of the hospitals. We save lives daily. We lost so much because of Bill 124, Speaker, but they continue to show up for work. Now it's the time for the government to stop forcing them out of their jobs because they are living with unlivable wages. Will this government properly fund community health care centres at the health care rate of inflation?
Members will take their seats. Minister of Health.
Thank you. 16% increase since 2018. And where was this party? They voted against every single one of those investments, whether it was fall economic statement, estimates, or budgets. You always vote against the investments we make in the province of Ontario. The $110 million investment in primary care multidisciplinary teams does, in fact, include community health centres, and they do get an increase in their annual operating budget. Why, Speaker? Because we see the value in the multidisciplinary teams. Why do we continue to expand primary care in the province of Ontario? Because we see the value in making sure that we have a stable healthcare force that is connected to the people in our communities. We'll continue to make those investments, rebuild the province of Ontario in our healthcare system, and the people of Ontario will watch who votes in support of those investments.